Okay, so we have, um, so the patient is an 18-year-old male who presents with abdominal pain. The symptoms include pain that is located to the epigastric area. The patient describes the pain as a burning sensation. The onset was gradual 3 weeks ago. There is no known event that precedes the symptoms. The symptoms occur or are currently intermittently and mostly during the day. The pain has been occurring daily. It's described as mild and unchanged. Symptoms are exacerbated by eating certain foods such as spicy foods or red sauces. Symptoms are relieved by occasional use of over-the-counter antacids. The associated symptoms do not include any fever, shortness of breath, chest pain, pain that radiates to the back, nausea, vomiting, or weight loss. The patient is not currently being treated for this problem. In the office, his vital signs were stable. He had a temperature of 98.9. His pulse was 88 and regular. Respirations were 18 unlabored. Pulse ox 100 on room air. And blood pressure was 122/77. Physical exam, he was alert, oriented, well-groomed, and no acute distress. He did not have any rashes, normal breath sounds on auscultations, and he had easy respiratory effort with no use of any accessory muscles. Cardiovascular assessment was normal. He had normal heart sounds and regular rate and rhythm, no murmurs, gallops, or rubs. Abdominal exam, so the abdomen was soft. It was not distended. There were no palpable masses, no rebound tenderness or guarding. On inspection, the abdomen looked normal. There was some epigastric tenderness present on palpation, and bowel sounds were normal. Patient has no previous diagnoses that were actively being addressed. He was just there mainly for the epigastric pain. So for the assessment, it is epigastric pain. For the plan, so we have some differential diagnoses of possible dyspepsia versus gastritis, H. pylori, or maybe some peptic ulcer disease. So on the given the exam, which did not have any alarm symptoms or any alarm symptoms on the history, went ahead and ordered some labs for the patient, which he completed that day. Labs included a CBC, a CMP, and we ordered H. pylori testing from stool test. We were considering further testing with an EGD following those lab results. And if negative for H. pylori, we discussed with the patient possible trial of a PPI. We did advise the patient to eat smaller meals, remain sitting upright for 20 minutes after eating, avoid eating right before bed, and then limiting the intake of those foods that were triggers, such as the spicy foods, tomato products, and others like chocolate or fatty foods, citrus, caffeine, and alcohol. He was advised to return to the clinic if he did experience any worsening symptoms, especially weight loss, dysphagia, blood in the stool, or any blood in his vomit.